Hey everybody, this is Bailey. Today I'll be sharing some tips that is more geared toward to medical professionals dealing with deaf and hard of hearing patients. But I'm sure there are some tips in there that would generally apply to outside the medical situation. Who knows? But let's get started. Tip number 1. Read the patient's record. Definitely check the demographic information to check to see if they have deaf or hard of hearing status on that record. This way you can mentally prepare yourself for communication barriers and or difficulties that you might have during that appointment. Tip number 2, accommodations. If they need an interpreter, they can apply for one in advance. However, if they don't need an interpreter because they have a hearing device like cochlear implant or hearing aids, just make sure that you face them at all times and speak clearly. And also make sure that your lips aren't obstructed so we can read your lips. Like this guy did. I'm ready what he said. Tip number 3, no interpreter and no hearing device. Okay, this is something that I have to put out there. Do not use family as their interpreter. They're not medically certified, so when you ask your questions, they may not know what information you might be asking for. So therefore, that communication translation could get lost. And also, using family as their interpreter means that they could potentially take over the conversation for them, taking your valuable time away from your patient. To get around the communication barrier, there are 2 ways to do it. 1, ask them if they can read lips, like so. If they can, great. However, be sure to do it in 1 sentence liner, like so. How are you feeling? Instead of a paragraph. Your patient chart said that you have pain in your left shoulder and that pain increased as you move. How's it feeling right now? Do you rather read the 1 sentence or the paragraph? For me, I say 1 sentence. But if you can read all that paragraph in 3 seconds, I'm impressed. The second way is if they cannot read your lips, you can write back and forth. Just be sure to write at 4th grade level. In ASL grammar, it's a little harder to translate over to English. In ASL we say, like English, we say, where's hospital? In ASL, it says, hospital where? So, be sure to dump it down to 4th grade level. So no nausea, no migraine, no... I don't know what other words you would use, but definitely use the terms that 4th graders would know, like how's your pain? Are you dizzy? Do you throw up? Or do you feel sick in the stomach? Or whatever, that kind of thing. Tip number 4, keep them apprised of everything. We have been oppressed for so long by this society, so we're a little slow on trusting the hearing population. Here's for example. Excuse me, I need to step out so I can discuss the results with my tech. I'll be right back. That's all you need to do. And this way they feel comfortable knowing that you're not hiding anything from them. Tip number 5, when they do have an interpreter, never ever ask them not to translate. Number 1, that's pure discrimination and unprofessional. And number 2, if you don't want your patient to know, then don't say it. Tip number 6, treat the interpreters as the patient's narrator. So if you missed something, you ask the patient to repeat themselves. And by asking that patient, lets them know that you're paying more attention to them, not their interpreter, which makes them feel valued and makes them trust you better. Also, side note, be sure to have the interpreter at your side or slightly behind you. However, you don't really need to tell them that because they generally know the drill. But when you get new interpreters, you definitely have to ask them to, whichever the best ear you have, put it on your side and slightly behind you. Bonus tip, learn ASL if you can. Lightprint.com is the best site to go to for free classes. And there are deaf coffee chat, so you can practice your knowledge. You will find them on, normally you just Google deaf coffee chat and find your local area. And this is also the best way to go because while you're learning the broad ASL, you're also learning the local ASL, just like slang words have in certain locals that you wouldn't hear in other area. And once you learn ASL and they find out that you know ASL, they will be floored and they would totally recommend you to their friends and their family, and those friends and family will pass it on to everyone else in the community, which brings your patient base up to, a higher number than you would believe. But be prepared. You might get a lot of deaf people, so be ready. Alright, this is all I have for you today. So if you have any questions, please drop them in the comments down below or text Michelle if you know her. And I'll see you next Saturday.